Hi there. Welcome to the Players Health Concussion Training video. We're here working to create the safest environment for athletes, coaches, parents, and all those involved in sports. In doing so, we create a place where fun and peace of mind live together. Every day we show up at work to help keep you informed on the risks you may face and how best to mitigate them. We've put this video together to continue to help you stay informed with concussion management and best practices to help you manage the safety of your athletes. Let's start with a question. What is a concussion? Well, according to the Center for Disease Control, a concussion is a type of brain injury caused by a forceful bump, jolt, or blow to the head or body. The thing that makes spotting a concussion hard is that it's an invisible injury. You can't see a concussion the way you can see a broken arm or leg, and that's why it's so important to understand the signs and symptoms so you know when to take your athlete out of the field of play. Now, before we get into the signs and symptoms of a concussion, it's important to know that these are very serious injuries and will get worse if they're not treated the right way. When an athlete is injured on the field, it is your decision as a coach or volunteer to pull an athlete out of the game or practice, regardless of whether they're sure it's a concussion or not. Remember, when in doubt, sit them out. Every concussion can feel and look different. Some of the most common symptoms reported by athletes are headache or pressure in the head, nausea or vomiting, balance problems or dizziness, blurry vision, sensitivity to light or noise, feeling sluggish, hazy, foggy, or groggy, problems with concentration or memory, and athletes also report that they just don't feel right. Along with these symptoms, there are also signs of a concussion that may be visible to people around them. Here are some signs coaches and volunteers have reported seeing in concussed athletes. Appears dazed or stunned, confused about assignment or position, is unsure of game, plays, score, or opponent, answers questions slowly, shows behavior or personality changes, can't recall events prior to hit or fall, can't recall events after hit or fall. Concussion symptoms usually show immediately, but they can take hours or even days to appear. A player that is assessed for a concussion needs to be assessed again a few hours later and cannot be left unsupervised. The coach or volunteer in charge of the athlete needs to speak with the parents right away before the athlete leaves to go home for the night. Here are some symptoms that call for an immediate hospitalization. One pupil larger than the other, drowsiness or inability to wake up, a headache that gets worse and doesn't go away, weakness, numbness, or decreased coordination, repeated vomiting or nausea, slurred speech or unusual behavior, convulsions or seizures, or loss of consciousness. It's important for coaches and volunteers to know signs so they can remove athletes from play, but it's also important for parents to understand this as well. Not just to understand why their child is being pulled out of a game, but because they spend more time with their children than athletic trainers do, especially on nights and weekends. Parents are best suited to observe their child's behavior and see concussion signs. Ultimately, the decision for an athlete to return to play should be made by a healthcare provider. If an athlete shows up to practice without a note from their doctor after showing signs of a concussion, they should not be allowed to participate and should seek out their healthcare provider for next steps. Some people believe it shows strength and courage to play when you're injured. This is wrong and can put young athletes at risk for lifelong injury problems. Do not let others pressure you or the injured athlete to continue playing. If an athlete tells you they're fine or they can tough it out, let them know taking a timeout to sit and assess their injury is not a sign of weakness and that playing with a concussion is dangerous. Make sure your athletes and their parents understand this. Again, when an athlete is on the field, they are your responsibility. It is your call to take them out. Let's move on to how athletes can recover from a concussion. Oftentimes, physical and cognitive activities such as learning and concentration can disrupt the recovery of a concussion and should be monitored by a healthcare professional. Students who return to school after a concussion may need to take rest breaks, spend fewer hours at school and receive help with schoolwork, be given more time on tests, and spend less time on activities that involve being on a computer, reading, or writing. After an athlete has returned to normalcy in school, there are 5 gradual steps to return to play. The baseline for these steps is when the athlete is back to their regular school activities and has received the green light from a healthcare provider to begin the return to play process. Only move to a new step if they do not have any new symptoms. Step 1, light aerobic activity to bring the heart rate up. This can include 5 to 10 minutes on the bike, walking, or light jogging. Do not use any weights during this stage. Step 2, add activities that increase the athlete's heart rate and incorporate limited body or head movements. This could include moderate jogging, brief running, moderate intensity stationary biking, and moderate intensity weightlifting. Step 3, heavy non-contact physical lifting, such as sprinting, running, high intensity stationary bike, the athlete's regular weightlifting routine, or non-contact sports-specific drills. Step 4, reintegrate the athlete into full contact practice sessions. Step 5, return to play. Remember, this is a gradual process. These steps should not be completed in one day, but rather over a few days, weeks, or even months. Keep your eye out for returning symptoms such as fuzzy thinking and concentration issues. If symptoms occur, go back to the healthcare professional, and when given the go-ahead, start again at the previous step. Be prepared for the player to resist and feel frustrated. Talk honestly with the player about the situation. Be honest about the risk and just offer support. Tell the player they will start feeling better as the days go by. Finally, it is important to know that you can teach your athletes ways to best avoid concussions by expecting, modeling, and reinforcing safe play. Many concussions come from illegal and unsafe play. Setting time aside throughout the season to educate your athletes about concussions. Creating an environment that includes positive messages on concussion reporting. When young athletes receive negative messages from their coaches, they may feel pressured to keep silent or to keep playing with concussion symptoms. This can put the athlete at risk for causing even further damage throughout their athletic career. Thank you for taking part in our video training on concussions and caring about creating a safer environment for all athletes. Being able to spot, treat, and prevent concussions means you are prepared if you need to put an athlete into concussion protocol. Although there are continuous safety rules and process changes in sports, concussions are still a possibility. By being properly prepared, you can ensure your organization is ready to respond when it matters. For more information about our services, please visit playershealth.com.